Thank you, Hillary. Our next speaker is Allison Dovi. She is a fifth-year school psychology PhD candidate in the College of Education. Her advisor is Dr. Sam McQuillan. Although she is originally from the DC metropolitan area, she graduated with a BS in psychology and anthropology from Michigan State University before pursuing her doctoral degree at Houston. Allison is currently completing her third advanced practicum, where she provides crisis intervention services in Houston ISD campuses. When she's not working on school-related activities, she can be found relaxing with friends, visiting her family in Virginia, or procrasti-baking, which is Allison's unique skill that involves making delicious treats for friends and colleagues while delaying schoolwork for a couple of hours. Allow me to introduce Allison Dovi, who will discuss her work on how doctors' use of framing may influence parents' decisions to initiate non-FDA-approved medications to treat their child with ADHD.
All right, so imagine that you and your significant other are about to go out for a fun evening, and they turn to you and ask, "How do I look?" If you're smart, you're going to quickly but carefully think about the next few words that are about to come out of your mouth. If they look great, then you may say so. But if the highlighter pink and yellow dress really does hurt your eyes, then instead of saying something like, "Wow, honey, that dress is really ugly," you're probably going to say something more along the lines of, "Wow, honey, that dress is one of a kind." Are you lying? No. But are you twisting the way the truth is being presented? Definitely. Trying to change someone's opinion, in this case about their outfit, by slightly altering the way information is being presented is called framing. This concept has been around for a long time and is often used in social movements, politics, and in marketing. We all use framing from time to time to influence the decision and opinions of others, but today, I'm here to talk with you about how doctors use framing to influence your healthcare decisions. In recent years, the medical field has started to use framing to encourage patients to engage in more positive healthcare behaviors, such as regularly brushing your teeth or receiving certain vaccinations. By carefully constructing these messages, the medical research has found great success in encouraging more and more patients to engage in these healthy behaviors, which is absolutely fantastic. But I'm here to tell you that not all framing is good framing. Specifically, when doctors use framing to encourage parents to be more accepting of a class of drugs known as second-generation antipsychotics when speaking with parents about treating their child with ADHD. Now, for the remainder of our time together, I'm going to refer to second-generation antipsychotics as SGAs. And I know some of you may be thinking, well, what happened to stimulants like Adderall and Ritalin, or even non-stimulants like Strattera in treating ADHD in children? Well, traditionally, we still do use stimulants, non-stimulants, as well as a range of behavior alternatives. But in recent years, SGAs have been increasingly prescribed to treat children with ADHD, even though it is not currently approved by the US Food and Drug Administration. In fact, the FDA has only approved SGAs to treat behavioral symptoms associated with autism, bipolar episodes, and schizophrenia in children. Yet one study found that 43% of children with a diagnosis of ADHD were receiving at least one SGA as part of their treatment plan. And even though this practice is not considered to be first, second, or third-line treatment, SGAs are increasingly being prescribed to vulnerable populations, such as ADHD youth from low-income and minority families, as well as those involved in the juvenile justice and foster care systems. In fact, one study found that foster care youth with a diagnosis of ADHD were 3 times more likely to receive an SGA than ADHD youth still living at home with their families. And although research findings regarding the long-term effects and safety of this practice are largely inconsistent, Many studies have documented significant weight gain, which may lead to type 2 diabetes, as well as increased sedation in children that use SGA medication. I've observed these side effects firsthand through my clinical experiences in 2 school districts, a juvenile detention center, and an inpatient psychiatric facility. I have seen how gaining up to 15 pounds in about a month and a half can negatively impact a teenager's self-esteem, while falling asleep in class can cause a child to miss instruction and fall behind. So why is this happening? Why are SGAs increasingly being prescribed to treat ADHD in children when we know that it's not FDA approved, we know that it's not first, second, or third line treatment, and we don't know very much about the long-term effects and safety of this practice? So why is it happening? Well, similar to how we use framing to protect our loved ones' feelings about their poor fashion choices, I believe that the increase in SGA prescriptions may be in part due to the way that doctors present or frame this type of medication when speaking with parents. Instead of referring to an SGA as a second-generation antipsychotics, doctors intentionally or unintentionally refer to SGAs as mood stabilizers. Now, it's important for me to tell you that the term mood stabilizers is not a term that is formally recognized by the FDA. So I believe that calling an SGA a mood stabilizer may be encouraging parents to be more accepting of this type of medication. For those of you who are parents, doesn't the idea of stabilizing your ADHD child's mood with a mood stabilizer sound much more appealing than giving your child with ADHD an antipsychotic medication? Since the average individual is not an expert in pediatric psychopharmacology, I believe that parents may be swayed to accept and eventually initiate this type of treatment when it is framed as a mood stabilizer. So, since SGAs can have a significant impact on the developing child, I'm currently in the process of formally testing whether framing an SGA as a mood stabilizer does in fact influence parents' acceptability of this non-FDA approved practice. In my study, I invite parents to watch a 2-minute video of a doctor, this doctor, hypothetically prescribing their child an SGA medication and ask parents to rate how accepting they are of this drug when it is framed as an antipsychotic, a mood stabilizer, and a psychiatric drug. It is important to remember that we all use framing. However, using framing to protect your significant other's feelings, to strengthen the relationship, has a very different impact than using framing to encourage parents to be more accepting of a powerful drug that is not approved to treat their child's condition. I believe that it is important to provide parents with accurate information about medication being prescribed to treat their child, specifically the drug's true drug classification, because this information may enable parents to consider alternative treatment options, prompt them to ask some additional questions, and allow them to make a more informed decision about their child's health care. For example, if a doctor were to tell you that they wanted to prescribe your child an antipsychotic medication that was not approved to treat your child's ADHD, you may be inclined to ask some additional questions. If my line of research consistently finds that framing does in fact influence parents' acceptability of SGA medication, then working with policymakers to encourage doctors to use accurate and appropriate language may be my future. But for now, as a school psychologist in training, I want to encourage all of you, especially parents, to be aware of how doctors may be using framing to influence your healthcare decisions and empower you to ask those additional questions before your doctor reaches for the prescription pad. Thank you.